Hello, I'm Daniel Young, an associate professor at the University of Nevada, Las Vegas, and I'm a physical therapist with a clinical background in acute care and critical care practice. After working in the hospital for a number of years, I went back to school for a PhD in public health. And as I was finishing that degree and thinking about the questions that I wanted to be able to answer, I recognized that I was going to need additional training in health services research. So in 2016, I applied for a part-time faculty fellowship with CoHSTAR and was selected with Alan Jetty as my mentor. He introduced me to some of the folks at Johns Hopkins who lead their activity and mobility promotion group, and I began to work with them. We have studied questions about hospital rehabilitation care, specifically things like measurement of physical function across care providers, and translating our knowledge about the importance of mobility and activity and physical function into routine practice. I finished my CoHSTAR Fellowship at the end of 2017, but I've continued to work with the folks at Johns Hopkins in the AMP group and have an appointment there as an adjunct associate professor in the School of Medicine. It's hard to gauge the impact of all of this work on the profession of physical therapy as a whole. But I think noting some of the grants, publications, and presentations that I've been a part of because of this CoHSTAR Fellowship can help to underscore the importance of the work. I'm currently a part of 4 different funded grants, and we have another grant which is under review. These grants involve questions about prehabilitation. What can we do with patients before they get into the hospital that will optimize their outcomes during and after? How can we predict the disposition of patients as they're leaving the hospital with measures of mobility or activity early in hospitalization? Can we measure physical function across the continuum of care systematically rather than just in siloed episodes of care? And can we help nurses to set mobility goals that they can then work to achieve with their patients while they're in the hospital? I've been a part of over 20 poster platform or plenary presentations related to this work and have 10 papers published or under review, one of which was published in the highly ranked JAMA Internal Medicine. It's safe to say that this CoHSTAR Fellowship has accelerated my career and given me opportunities I had only dreamed of before. I want to thank CoHSTAR and its faculty, especially Alan Jetty, for mentoring me, and the Foundation for Physical Therapy, because of their support and recognition of how important this work is. Thank you.